Okay, so first we'll start by scanning the room. Okay, so first I came into the room. I provided the patient with privacy. I've washed my hands and I've checked the chart for any orders. Hi, my name is T. I'll be your student nurse today. Can I have your first and last name?
Tatiana Albert.
And your date of birth?
January 3rd, 1991.
Okay. All right, so what brings you in today?
Physical.
All right, are you currently in any pain?
No.
Okay, so do you currently know where you are?
Yes. The doctor's office.
All right, and do you know who the president is?
Donald Trump.
And do you know what today's date is?
November 27th.
Okay, so the patient does look relaxed. She is groomed and dressed appropriately for this appointment. She does seem to be relaxed. She has a relaxed affect. I don't know any involuntary movement. She doesn't seem to be anxious or nervous or anything. Her speech is clear. She is understandable. She understands me great and responds to questions appropriately. So I'll give her a Glasgow Coma scale of 15. Okay, so we'll do our exam. We'll try to do our exam in a head to toe fashion, starting with the top with your head. Do you have headaches or anything?
No.
Have you ever had a head injury?
No.
Do you notice your hair falling out?
No.
Thinning of your hair?
No.
Do you have excessive dandruff?
No.
All right, so just inspecting the patient's head. Her head size does look normal cephalic. It doesn't look too big or too small. I don't know any nodules, bumps, or masses in her head. Her hair texture is fine and soft. Her hair is evenly distributed from her scalp and her eyelashes and eyebrows. So her skin is normal for ethnicity. I don't know any cyanosis or any jaundice or anything like that. So with that being said, we'll start palpating your scalp at any time. You let me know if you feel any pain or tenderness. Alright, so feel it around the patient's skull and scalp. I don't know any masses, lesions, or nodules in the patient head, so that is good. So then we'll move down to your eyes. Do you have any issues with your eyes?
No.
Do you suffer from watery eye?
No.
Dry eye?
No.
And when was the last time you've been to your eye doctor?
3 months ago.
All right, so the patient doesn't need a Snellen eye chart test, which is cranial nerve 2, which is intact. If not, then we'll have her read a Snellen eye chart to test her visual acuity. So looking at the outer canvas of the eye, it does look moist, doesn't look dry. I don't see any lesions or anything on the eye. The pupils are equally round. I will note the pupil size at about a 5. I'll give her a 5. So we're going to do a couple tests with your eyes. The first test that we're going to do is we're going to shine a light twice in each eye to test for central and direct constriction of the eye. All right, so you're going to look at my Alright, so the eyes did constrict consensual and directly to light. So the next test we're going to do with your eyes, we're going to do your 6 cardinal gazes. What I want you to do is follow my pen light with your eyes, try not to move your head. Okay, so the patient was able to follow the pen light with her eyes, not moving her head. So the next thing we're going to do, I want you to focus on my pen light. I'm going to move it towards your face, and I want you to focus on it once it gets close. Ready? Okay, so the patient's eyes did accommodate to focus on the object in front of her. So cranial nerves 4, 5, and 6 are intact. We're going to move down to your nose. Do you have any issues with your nose?
No.
Do you smell normally?
Yes.
So cranial nerve 1 is intact because the patient doesn't have any issues smelling at all. So do you suffer from nosebleeds?
No.
Dry nose?
No.
Okay, so inspecting the nose does look midline. It doesn't look to have any dry skin or any nodules or maculas on the nose. So we'll look up your nose. The nose is pink and moist. I don't know any deviations or perforations in the nose. All right, so can you occlude one nostril and breathe in? All right, on the other side. All right, so the patient's nostrils are patent, which means they are open. She's able to breathe through them. So the next thing we're going to do, we're going to move to your ears. Do you have any issues with your ears?
No.
Do you notice any drainage from your ears?
No.
Any pain in your ears?
No.
Have you ever had any surgeries on your ears?
No.
Alright, so inspecting the ears do look normal size. The top of the ears are lined up with the outer cavities of the eye, which means they are normal size. They are symmetrical on each side. I don't know any drainage or foreign bodies in the ear. It is a normal amount of cerumen in the ears. Same on this side. No drainage, no foreign bodies, and a normal amount of cerumen in the ears. So the next thing we're going to do is we're going to push on your pinna. If you feel any pain, let me know. Pull on your trays and push on your mastoid process. Any pain?
No.
All right, so while we're there, we're going to palpate your temporal arteries. Okay, I'll grade those as a +2 equally bilateral. So next we're going to move down to the patient's mouth. Do you have any issues with your mouth?
No.
Are you able to taste your food and drinks?
Yes.
When is the last time you've been to the dentist?
In January.
Okay, and do your gums bleed when you brush your teeth?
No.
All right, so can you smile? So the patient's teeth does look nice and white. Her gums are brown, which is normal for her ethnicity. Can you open your mouth and stick your tongue out? All right, can you lift your tongue up? Can you move your tongue side to side? All right. Can you say ah?
Ah.
All right. So the patient's mouth is pink and moist. Her tongue is moist. I did note the rise and drop of the uvula. Her tonsils are present. I'll grade those at about a +2. The soft and hard palate is pink and moist. The buccal mucosa, the pharyngeal wall, and the tongue is also pink and moist. Can you smile? Puff out your cheeks. Frown. All right, so cranial nerve 7 is intact. So next thing we're going to do with your ears, I'm going to do a whisper test on your ears. So I'll go behind you, and on either side I'll whisper a word and you tell me what word you heard and what side it was on. So you can kind of cue forward this way.
Table.
Which side?
On this side. Apple.
Okay. So I'm gonna make a noise on either side of you and just tell me which side you heard the noise on. Okay, so the patient's cranial nerve 8 is intact. The patient was able to hear. So the next thing we're going to do, can you shrug your shoulders up? All right, shrug your shoulders up again. All right, so cranial nerve 11 is intact. The patient was able to shrug her shoulders. And one last thing, can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, so cranial nerve is intact. Patient was able to use the tip of her tongue to form those words. The next thing we're going to do, we're going to go down to your neck area and your chest. Do you have any issues with your neck?
No.
Do you wake up with a stiff neck or anything?
No.
Have you had any surgeries on your neck?
No.
All right, so looking at the patient's neck, I don't know any masses or bulges in the neck. So the first thing we're going to do, we're going to palpate your carotid arteries one at a time bilaterally, just so we don't occlude them so the patient doesn't pass out. So that's in the lower 1/3 of the neck. Okay, so I'll rate those at a +2 equally bilateral. So the next thing we're going to do is going to listen for any bruits in those same areas on your neck, but we're going to place a stethoscope in 3 different spots. What I want you to do is take a breath in and hold it. Okay, so breathe in and hold it. Okay, you can breathe. Same thing other side, take a breath in and hold it. Okay, so no bruits or anything noted in that area, so that is good. So next thing we're gonna do, we're gonna palpate for your thyroid gland. So you can turn this way again. All right, so how to palpate for the thyroid gland is you're gonna put your fingers on both sides of the trachea, and to palpate each side, you will want to push the trachea to one area, trying to get behind it. So right now I'm palpating on the right side. All right, so we're gonna go to the left side. We'll push the trachea over to get behind it. All right, so her thyroid gland is not palpatable is what we wanted, and her trachea is movable, which is a good thing. So next thing we're going to do, we're going to move down to your chest area. Do you have any issues with your chest as far as like shortness of breath or anything?
No.
Have you ever had pneumonia?
No.
Bronchitis?
No.
Asthma?
No.
Do you have trouble breathing?
No.
And have you ever had a chronic cough that you couldn't get rid of?
No.
Okay, so looking at the patient's chest, she doesn't seem to be in any respiratory distress. She doesn't seem to be using any accessory muscles. She does seem to be relaxed, no nasal flare, which would prompt me to think that she is having trouble breathing. So first we're going to map out our fields. We're going to start with the sternal notch, which is about right here on her. And we'll go down to the angle of Louis. Then we'll come over to the second intercostal space, right sternal border, which is our aortic. Then we'll come over to the second intercostal space, left sternal border, which is our pulmonic. Then we go down 1 to the third intercostal space, which is the Erb's point, I'm sorry. Then we'll go down 2 to the 5th intercostal space, which is the tricuspid. Then we'll stay in that 5th intercostal border, go over to the mid-clavicular line, which is the point of maximal impulse. And right here, we will also note any lifts or heaves there, but we don't note any of those, which is a good thing for the patient. So the first thing we're gonna do, we're gonna percuss your lung fields. So we're gonna start here. Alright, so those sounds were resonant, which is a good thing. That's what we were looking for. So the next thing we're going to do, we're going to listen to your lung sounds. I'm going to have you take a full breath in and out, and each time I place my stethoscope on your chest. And we'll do that with the diaphragm, so we'll start here. Exhale. Okay. Breathe in. Breathe out. You don't have to hold it, just breathe in, breathe out. Okay, so the lung sounds were clear. I don't know any adventitious sounds, no crackles, no bronchi, no wheezing heard. So the next thing we're gonna do, we're gonna listen to your heart sounds in the same spots that we pointed out earlier. So we'll use our diaphragm. So we'll start at the second intercostal space, the aortic. Right here, right with the diaphragm. Then move to the second intercostal space, left sternum border, which is the pulmonic. Go here. Okay, so the patient heart sounds were normal. I noted S1 and S2 were normal. I didn't hear any extra sounds or murmurs that were noted. So next we're going to go to the posterior chest. Come this way, Nikki. Come this way. All right, so looking at the patient's back, her skin is warm and dry to touch. The hair is evenly distributed on the back. So we'll map out our lung fields. We'll start, first of all, we'll palpate the chest. I don't note any crepitus or anything on the back, which is a good sign. So the first thing we do, we'll map out our fields. Can you tilt your head down? I'll C7 right here on her. Then we'll go down to T8, which is the bottom of the scapula, which is about right here on her. Then we'll move down 3 spaces to T10, which is about here. So we'll pinch in, we'll take a breath in and out. All right, so symmetrical expansion was normal. So we'll do your AP diameter. I'm gonna put your arm up here. So we'll start with the anterior chest, move into the posterior chest, which is normal size, is about a 2-to-1 ratio. You can relax your arm. So first we'll do the same thing as on the front as we did. We'll do it on the back. We'll percuss your lung fields. We'll start here. I have to like flip your sports bra up just a little bit. Then we'll go down to T10, I'm sorry. Then we'll come over to T8 and come up to T6. And the same on the other side, T8 up to T6. All right, so those sounds were resonant throughout, which is a good sign. So the next thing we're gonna do, we're gonna listen to your lung sounds in the back. So you're just gonna take a deep breath in and out. Take a breath in. Yeah, I'm just gonna flip your sports bra up. Just a few more. Okay, last two. Up to T6. Okay, so the patient's lung sounds were clear. No adventure sounds, no rattles, no bronchi or wheezing heard. So the next thing we're gonna do our tactile thermometer. So every time you feel me place my hands on your back, would you say 99?
99, 99, 99, 99, 99, 99.
Okay, so tactile thermometer was normal. I did note the decrease in vibration as I went down the patient's back. Okay, so I'm gonna go ahead and have you lay back for me. All right, so looking at the patient's neck, can you like stretch your neck up like this? Looking at the patient's neck, I don't know any JVD, jugular vein distension. You can relax your neck. If I did, I will raise the patient up to 45 degrees and check for the jugular vein distension again. So looking at the patient's arms and legs, we'll just pull these up into it. All right, so the skin is warm and dry to touch. I don't know, the hair is evenly distributed throughout the extremities. So can you squeeze my fingers? All right, can you pull, push? All right, so the patient arm strength is normal, so we're gonna test your cat refill on your fingers. Okay, so cat refill on the fingers is less than 3 seconds, so that is normal. So we're gonna palpate your brachial arteries. Brachial pulses, okay, so I rate those at a +2 equally bilateral. We'll move down to your radial. Okay, so I'll rate those also as a +2 equally bilateral. We'll move down to the popliteal behind the knee. That one was a bit faint, so I'll rate that as a +1. Okay, so I'll rate that one as a +1 also because it was also faint. So we'll go here and we'll palpate your posterior tibial arteries. Those are at like a +2 equally bilateral. Your dorsal pedis at the top of the foot. Okay, those are also +2 equally bilateral. So I'll check your cat refill of the toes. Okay, so those were good. Those were less than 3 seconds. So I'm going to touch the bottom of your foot with my little Q-tip here. You want to tell me if it's hard or like where you feel it.
Left foot, bottom of the foot, the middle, toe.
Okay, all right, so that's good. All right, so the next thing I want you to do, can you pull your feet up? All right, can you push down like you're driving? All right, so the patient's leg strength is normal, so I don't know any edema around the ankles. All right, and the hair is evenly distributed on the legs also. Can you raise this leg up off the bed? Up in the air. Okay, can you relax? Relax. This one. Okay, you can relax. All right, so I don't know any edema around the wrist either, so that is good. So next thing we're gonna do, we're gonna move to your abdomen area. So looking at the patient's abdomen, it does have a flat contour. I don't note any pulsations or anything in the stomach. Or umbilicus is midline. So with your stomach, do you have any bowel problems?
No.
Do you remember last time you had a bowel movement?
Yes, this morning.
Okay. And do you urinate? Your urination, is it normal?
Yeah.
Do you have any burning or itching?
No.
Do you know any pus in your urine?
No.
Any blood in your stool?
No.
Have you had any surgeries on your abdomen?
No.
Are you currently in any pain right now?
No.
All right. And have you ever had children?
No.
All right. So do you have any issues with your reproductive system?
No.
All right. So do you have normal menstrual cycles?
Yes.
Okay. So a good tip about, do you do breast exams?
No.
All right, so with your next time after your period, about a week after your period, that would be a good time to do a self breast exam of yourself. So what you're going to do, you can either like stand in front of the mirror with your hands on your hips to make sure the size of your breasts are equal. You don't know any bumps or like nodules like noticeably on your breast. And another thing you do, you can lay down on your back with one hand behind your head, starting in your armpit, and work your way to your breast in a circular motion. What you're feeling for is any hard nodules that won't move. If you did find those, then you'll want to go to your doctor. Okay, so with your stomach, we're going to assess your stomach. Like I said, it does have a flat contour. I don't know any pulsations. The umbilicus is midline. Before we start, are you in any pain right now?
No.
And do you have to use the restroom?
No.
Okay, so first we're going to the abdomen is different, so we're going to actually listen to the bowel sounds first. So we're going to start in the right lower quadrant, working our way around. All right, so we'll start here. Moving up to the right upper quadrant. The left upper quadrant. And the lower left quadrant. Alright, so her bowel sounds were normal. It wasn't hyper or hyperactive. I did hear them. So next we're going to start with percussion of the same areas. So we'll start in the lower right quadrant. You're going to percuss in a couple areas each quadrant. Okay, so the sounds in your abdomen was timpani. That's what we're looking for. So the next thing we're going to do is we're going to listen to the brutes or anything in your aortic, iliac, and renal areas. So how we find those, you put a W on the stomach. This is the renal areas, and this is the aortic areas. We're going to listen to those with the stethoscope. And we'll listen with the bell of that. So we'll listen to the renal. Aortic. And the renal. Then we'll listen to the iliac. We'll make a V shape and we'll listen here. Alright, so no brutes or anything was noted when I listened to all those areas, which is a good sign. Normally we would palpate the femoral arteries also, but we'll skip that for the sake of this exam. So the next thing I'm going to do with your stomach is I'm going to do some light palpitation on your stomach. Before we get started, you said you weren't in any pain, right?
No.
And you don't have to use the restroom. Alright, so we're just going to do small circles in each quadrant, a couple spaces in each quadrant. You okay? Okay. Alright, so I didn't feel any nodules, no masses, no bumps or anything, which is a good thing. Normally we would do the deep palpitation, but we'll skip that for this exam because it's very discomforting for the patient. So with that, I'll go ahead and have you sit up. You can come to the edge. One thing you did forget to do, your cranial nerve 5 TMJ. Can you open, close, open? You want to move your jaw from side to side. Alright, I didn't know any clicks in anything. Can you swallow? Alright, so we're going to test the sensations on your face also. I'll use a different one for your food. So, I'm going to show you if it's sharp or soft touch and where you felt it, okay? So you can close your eyes.
So,
Where was it?
here.
Okay.
kind of feel hard over here.
Okay.
Just so
Okay.
hard.
All right. So that's pretty good. So that cranial nerve is intact. So can you go ahead and stand up for me? All right. Can you walk to the table and walk back? Okay. So the patient gait is normal. So can you put your arms out to your sides? Can you touch the tip of your nose with your finger? Okay. Alternate. Okay. Good. So can you run your shin, your heel down your shin? You put your arms down. Don't use the bed. Okay. Other side. Okay, you're a little bit off balance there, but that's okay. All right, so next thing we're gonna do a couple range of motion things. Can you put your arms out? Abduction, then we're gonna put our arms in. Adduction, can you put your arms in front of you? Extension, flex, extension, flex. Then you're gonna go supine, hands up, and prone, hands down. All right, so pretty good. So we're pretty much done with this physical here. So you just want to have a seat and doctor be with you shortly.
Okay.
All right, thank you.